Manitoba did something more progressive than any of those big cities ever did. We elected a strong team of New Democrats to fix healthcare and make your life more affordable.
That's Manitoba Premier-designate Wab Kinew following his victory in last week's provincial election. Kinew unseated Heather Stephenson and the Progressive Conservatives to form a majority government. Kinew won with a campaign heavily focused on healthcare and affordability, promising to cut the gas tax and hire hundreds more healthcare workers. His election is also, however, history-making as he becomes the first First Nations provincial premier in Canadian history. Manitoba's Premier-designate Wab Kinew is with us now. Hi, Premier-designate. Great to see you again, and congratulations once again as well.
Well, thank you so much, and thanks for having me back.
I do appreciate you making the time. You met this week, I saw through some video, with the person you're replacing, obviously the current premier, to talk about a transition. It was an incredibly divisive campaign at times. Do you think the nature of that will impede that transition at all?
No, I think a message that I've clearly communicated, and I think that all Manitobans are ready to move forward on, is that now that the campaign is over, we need to live together again as people in one province. And so for the next 1,000 days, let's work together to build up the future of Manitoba, and then, we can put our respective jerseys back on and campaign in the next general election. But for now, for the next 4 years, let's work together to advance our shared priorities.
And do you expect, Premier-designate, that full transition and you to fully assume the role to happen in the next few weeks?
Yes, I do. We're still working on just nailing down the logistics about a specific date, but we do have the intention of assuming government in the next few weeks.
I know this week you also, just after you won, spoke with the Prime Minister. We actually touched on that in our previous conversation. I wondered, I know you're fresh on the job, I acknowledge that, but I wondered when you, I'm sure you already have, thought about the parameters of your relationship with the federal government. What is your #1 priority in that relationship?
Well, my #1 priority is always healthcare. This is what we campaigned on, and this is what earned us a mandate from the people of Manitoba. Manitoba has seen its fair share of challenges, probably more than its fair share of challenges with healthcare over the past 7 years. There's been cuts, and then of course we've all dealt with the impacts of the pandemic, which kind of exacerbated the impacts of those cutbacks in the past. And so in the conversation with the Prime Minister, of course, he brought forward his priorities, but I was very quick to say that healthcare is my priority, and I want that to be both a constructive working relationship on the resources side necessary to fund and to make investments in our healthcare system. But I'm also a very passionate believer in universal access to healthcare, public healthcare, as being a fundamental Canadian value. And so I also did share with the Prime Minister my view that the federal government is the shepherd of the Canada Health Act, and consequently is a very important player when it comes to guaranteeing universal access to all Canadians.
There has been some debate recently in other provinces where there's still one payer, so the taxpayer, but there has been more private delivery of some services. The governments in those provinces have said that's necessary in order to clear up wait times, for example. Are you in principle against that?
Well, I think we're going to be pragmatic. We're going to take a common sense approach, and the reality is that the way that our healthcare system is structured in Canada is that you do have some companies involved. And so what I would say is that there's sort of a spectrum. And now I just want to explain to you and your viewers that I am married to a physician. Her name is Dr. Lisa Monkman. And so I'm a big believer in the work that the Dr. Lisa Monkman Medical Corporation does in our healthcare system, as one example. But then on the other side of the spectrum, you may have like Big Pharma, which I think a lot of Canadians would be skeptical of their motivations when it comes to the public good of healthcare in our province. And so I think really it's about finding a balance along that spectrum of the different players who are delivering healthcare in Manitoba and across Canada. And I think the way that we arrive at the right balance is by respecting the principles of the Canada Health Act.
The pragmatism that you talk about, at times, for example, your federal counterparts in the NDP have rejected, I think it's fair to say, the notion of, right, that if there's any private delivery, it should not be happening. It sounds to me, if I read between the lines of what you said, that you're not in principle completely against that if there's something that can be effective?
I think we're always going to put the people first. The people of Manitoba have asked for improvements on their health care. When we look at, just to drill down onto one specific issue, the surgical wait times, people who are waiting for hip and knee surgeries, people who are waiting for other procedures here in Manitoba. Right now, when somebody gets a referral and they're told that they have to wait 2 or 3 years, we know that we need to do better than that. And I'm a firm believer that the way that we cut down those wait times is by investing in the public system.
During the campaign, your critics in the governing party were quick to point out that the estimates you put forward and the ambitious nature of the promises you put forward couldn't really be reconciled. I'm wondering, can you hire all the hundreds of doctors and hundreds of nurses that you've promised to hire over 4 years, and hundreds of paramedics, I should say, without additional money from the federal government? Or is it your expectation that the feds do put more money beyond what's already transferred to Manitoba on the table?
I think the commitments that we have made can be executed within the existing fiscal framework. There was an increase of $750 million in federal transfers last year, which does give us the flexibility to pursue, this plan to add 400 more doctors over 5 years, 200 more paramedics over the next 4, 300 more nurses over the next 2 years. These are very specific targets that we laid out because we want Manitobans to know we have a concrete plan, and we also are expecting Manitobans to hold us accountable to deliver on those things. Now, of course, we are always going to ask that the federal government contribute its fair share when it comes to healthcare, and we know that the federal share of delivering healthcare has declined over the past decade. So obviously, we're going to continue to push for increased investment from the federal level, but there can be no excuse for inaction right now.
Other provinces have set ambitious goals for staffing priorities as well, and they have not been able to meet them. Many, in fact, are failing very abjectly to do so. What secret sauce sort of do you have that they don't have? And given the history of what other provinces are encountering, why should Manitobans believe you are going to be able to do that?
Well, I think that one of the things that we have identified carefully, we triaged, to use a medical term, and we've done so by listening to the physicians and the nurses and healthcare professionals on the front lines, is the need to improve the culture in healthcare. And of course, part of this is about the working conditions and ending mandatory overtime, giving more work-life balance to those on the front lines. But part of it is also to just deal with this overabundance of bureaucracy that exists in our healthcare system, which is not only getting in the way of delivering services at the front lines for you, the average Manitoban, the average Canadian, but it is also leading to burnout amongst those at the front lines.
Premier-designate, just before I let you go, I wanted to ask you about another subject. I was watching an interview with you from about a decade ago, in which you said that being an ambassador of sorts for Indigenous people, quote, isn't something you shy away of. I know I know I don't have to tell you that you're the country's first First Nations premier in our history. Do you still feel that way?
Well, I feel that I have a responsibility to young people in Manitoba and to across Canada. Certainly, I took time in the speech that I gave after the election results were announced to speak directly to young Indigenous Manitobans. But now that we have earned a mandate, yes, I do feel a responsibility to send a positive signal to young Indigenous people. I think every Canadian would want me to do that. And of course, to send a positive message to young people from every background that they can feel good about the province that we live in, that they can feel good about the country that we live in. And, politics is a rough and tumble sport, so I'm not necessarily encouraging these youth to pursue the same career that I have, but whatever it is that they choose to do, whether it's in business or sports or arts, culture, community, hopefully young people know that they can achieve those things and pursue their dreams.
Premier-designate, I'll leave it there. I do appreciate your time as always. Thank you and congratulations once again.